Alright, I'm going to demonstrate the interrupted suture and then go over the suture aftercare. So you'll put your gloves on. Hopefully these don't break because I haven't had the best luck with these because they're old. Leftovers from work. Please don't judge the way I'm putting them on. They're half a size too small. In the real world, I would not be putting them on this way. Okay, so I'm wearing gloves like we were advised to do. I've already cut incisions on here, but I'm going to show you how to do it properly. So blade 90 degrees, incision 2-3 inches down. So I kind of just re-slice what I already had pre-existing. Just ignore me patting on here, okay? Let me cover that up. Don't need your scalpel anymore. You're gonna have your sutures. Open it. You have your suture in here. Take your needle or hemostats. Grab your suture. Place your suture into your hemostat. Lock it in place. I am not in love with this suture string because it is very bendy. So I'm going to try to straighten it out just a little bit so it makes it a little bit easier for me. Okay, so you will start just a few millimeters outside your incision. Make it go in one side. You can come up through the middle if you want. I have actually been practicing not doing that. Unlock your hemostats. This equipment is not really great. Your string all the way through. So you only have just a little bit of string at the end. This is really okay. So you're gonna do a surgeon's knot. I'm gonna hold it with my fingers. These needle drivers are not the best to hold onto this really silky suture. So you do double wrap twice, pull through, make sure you pull it all the way through. Also, these hemostats are really big. So make sure you have a nice tight knot. And then you'll go back the opposite direction. So then you loop it once, grab onto your string on the other side, if I can find it. Pull it through, make sure your needle is nice and tight, or your knot, I'm sorry, not needle, knot. Alright, so one down, you will cut it. Only need a few millimeters of string, just long enough for whenever you take it out. Telling you, this suture is not the best practicing in the world. Grab onto it again, your hemostats, lock it. Trying to get this suture string from recoiling on me. Go in one side, not the other, equal distance apart. Grab your suture, pull your string all the way through to the very end, right there. Double wrap, wrap, grab your end, pull your knot, untrap the end of your line so it's not stuck, and then loop back the opposite direction. Grab the end of your line, do one more surgical knot. You also want to make sure that your previous suture that you just did, the ends don't get caught up. So there's two. Trim your strings, trim your strings. Be very careful about where your hemostat, or where your suture needle is. Not the best demo suture, just saying. Definitely seen sutures in real life that this string is not this bad. So make your incision, unlock your hemostat, pull your suture through, give yourself just enough slack on the other side to hold on to. Grab your one end, needs to be knotted. At this point, be very careful, double loop it, hold on to the end, pull through. Just not having great luck with how wild this suture is. Go back the opposite direction. This is where you're doing your surgeon knots. Make sure your knot is decently tight and appropriate. For wound closure, trim your strings. Trim your strings. Bam. Do one more. One more suture through here. Pull it through all the way. There we go. Be very careful with the end of your suture so you don't poke yourself. Wrap, wrap. Grab your end. Make your knot. Pull it decently tight. Once the opposite direction. Grab your end. Pull it tight. Trim your strings. Trim your strings. And we'll do, not anymore. Dispose your needle correctly. I have been getting rid of these, putting them back in the package and taking them back to work. However, let's put it over here so I don't poke myself later. Move this out of my way. Here you have it. 4 interrupted sutures with a surgeon's knot. Hopefully that video demoed okay. Aftercare instructions for this patient would be to keep the wound clean and dry for the first 24 hours. You can bathe 48 hours after. Clean the wound sutured area gently with soap and water and pat dry. You don't want to break the skin to where it's healing and cause infection. If there's a bandage there, you can remove it after 48 hours. Look out for signs of infection. Make sure there is No redness, tenderness, or abnormal swelling or discharge. If there is, you need to contact your doctor because it could be infected. And also make sure if you see that the sutures have come undone, also contact your physician to make sure that it is healing appropriately. Again, because that could cause infection depending on where it's at. So always look out for signs of infection. It's never a good idea just to leave it. Yeah, so interrupted suture, video number 1.